As we look at the healthcare landscape today and healthcare delivery, it seems that as though urgent care, as far as the grand scope of things, is kind of more of a newcomer. If you could speak to how has urgent care, and then more importantly in your space, the pediatric urgent care, how do you think that has impacted healthcare delivery so far? What impacts have you seen it make?
So I think it's been a great impact just by the sheer number that have come on the market since we started. And when we started in 2007, there was hardly anybody doing that, and even the insurance companies were like, "What is that?" But I really think it has given patients a lot more flexibility as far as where they go and how they get seen, so they don't end up in the emergency room. I think we still have a long way to go as far as using it correctly, because it's all about, I think, relationships and communication between the different entities, and we're not very good as an industry in doing that. I have my primary care business over here, I have my hospital over here, and the urgent care is someplace out there doing their own thing. I don't think we're using it to its fullest potential yet, but it can be used if we can start communicating and building relationships with each other.
Right. So, and from your perspectives, right, because I know you're in the industry, you're speaking with a lot of folks in the industry, are you seeing changes in the industry that's going to make it more cohesive, or what are you seeing right now?
Well, the mere fact that there's more urgent care options, I think urgent care is just here to stay. It's just part of the healthcare system, and even with the hospitals and health systems getting into urgent care, it lends a certain amount of validity to urgent cares. And so, the fact that people want urgent cares in their ACOs or in their health systems, or feeding from their primary care to urgent care. So you're seeing movement to where people are integrating urgent care into the continuum of care. And so I think, as we're reaching out to partners and we're reaching out to hospital systems about how do we get connected to your patients, and how do we respond and give you the information you need about your patients. I think it's coming. I think it's just, again, now the urgent care is here to stay. People are like, okay, how do we fit urgent care into our whole system?